Hello there. Thanks for joining me at A to B Training. Today we're going to be talking about the Alabama foot rot. Um, Alabama foot rot sort of earned its name from its initial diagnosis in Alabama, the USA, primarily affecting greyhounds during the 1980s. While first confirmed in the UK in 2012, its prevalence has been steadily increasing. The precise cause remains elusive, prompting ongoing research and efforts. So now let's talk about the possible environmental links. So the possible environmental links. Current understanding suggests a potential environmental factor in the transmission of Alabama foot. Animals frequenting wet and muddy areas are suspected of contracting the causative agent. Although this hypothesis lacks definite proof, notably, cases tend to surge between November and May, coinciding with the muddy, waterlogged conditions of woodland areas. Next, we're now going to talk about the symptoms and the actual progression of this. Now we're looking at symptoms and the progression. So the causative agent initially induces lesions on the lower part of the limb, extending from the foot to the carpus or the hock on the back leg. These lesions resemble ulcers, rapidly eroding the skin. When encountering such limb ulceration in animals exposed to high-risk environments, Alabama foot rot should be considered. Isolated skin lesions, although not fatal on their own, can escalate when the causative agent migrates to the kidneys, leading to potentially fatal kidney damage. This progression can occur within days of the limb ulcers emerging. These are just a few examples in pictures of Alabama foot rot and how it can affect especially dogs' feet. Now, let's take a look at the diagnosis and the treatment. The diagnosis and treatment, timely evaluation of limb ulcers is essential if Alabama foot rot is suspected. Kidney testing is often necessary to assess the extent of the infection. Unfortunately, treatment outcomes are frequently unrewarding, especially when the disease advances to the kidneys' involvement. Many cases where Alabama foot rot spreads to the kidneys result in a fatal outcome. So let's just quickly recap about the Alabama foot rot. Yes, it did originate in the United States, Alabama, but yes, since 2012, there have been steady increase in cases being recorded now in this country. The environmental factor seems to be quite a link to it, with the muddy waters, that type of thing, during the months between November and May. So when we're looking at signs like the symptoms, I think it's very important that this should not be excluded ever. Even though it is still very rare, it is very much a concern going forward. Yes, the diagnosis and the treatment. The diagnosis can be relatively easy to come by, but the actual treatment itself is very limited at the moment until obviously we have a better understanding of our Alabama foot rot. I hope all this made sense. Thank you very much. Hello there. Thanks for joining me today. This is A to B Training. Today we're going to be talking about gloves, how to put gloves on and obviously how to take them off in the correct manner. I have also heard over the years that people have a fear with first aid of getting infection from treating patients. So that's why it's very important that we remove the gloves in the correct manner. There does tend to be two different types of gloves in the industry, but the ones you'll probably end up using are the nitrile gloves, and less commonly used are the vinyl gloves now. They can be powdered or unpowdered. It obviously depends which brand that you go for and which type of packaging.